You are all muted and we cannot see you. Please use the Q&A feature to submit questions to the panel. You can submit questions at any time, and we will try to get to as many as we can. If you have technical questions, please use the chat feature and direct your questions to Carmen Burgos. Carmen is always working behind the scenes as our producer, and we could not do this without her. So thank you, Carmen. This briefing is being recorded, and you will all receive a link to the recording along with a written summary of what we learned today with links to additional resources. Before introducing our panelists, I want to tell you to be on the lookout for an invitation to the Foundation's annual meeting, which will be held on June 17th. And I would be remiss if I did not mention the upcoming Great Give, which I'm sure you are all aware of and looking forward to. So get ready for May 1st and 2nd. Visit thegreatgive.org. We have some great prizes lined up, some new sponsors, and over 530 organizations registered, and lots of fun planned for the 2 days. Without further ado, I'm going to ask the panelists to turn their cameras on. As I said, we have a really great group of panelists this morning to talk about this topic. And I'm going to ask them each to briefly introduce themselves and their organization. And I'm going to start with Lauri Lowell from HomeHaven. Lauri, welcome.
Thank you. Good afternoon. And HomeHaven is delighted to be here. Thank you so much. HomeHaven is an organization of about 250 members throughout Greater New Haven. We help our members remain active, independent, and productive as they age in their own homes in the neighborhoods and communities that they love. We help our members provide volunteer services to each other, social activities, all kinds of engagement and meaningful programs and presentations. And feel free to contact me for more info. Thank you.
Thanks, Lauri. Thanks for being with us today. Mike, you're up next.
Thanks. Hello, everyone. I'm Mike Rambarose. I'm privileged to serve Whitney Center. We are what's called the Life Plan community in Hamden. We serve about 480 individuals and families here on our campus location, as well as our at-home program throughout the state. We offer a range of services from independent living to assisted living to skilled nursing, memory supports, personal care, and care coordination and navigation to all of those folks on a daily basis. Thank you for having me.
Thank you, Mike, for joining us. And Nora, you're up next.
Hi, thanks for having me. Great to see so many people logging on. My name is Nora Duncan. I'm the state director with AARP here in Connecticut. AARP is a nonprofit, nonpartisan social mission organization with a membership, mostly people age 50 up. We've got a 600,000 or so members here in Connecticut and about 38 million nationwide. And here at the state office, we work on advocacy, education, outreach, and fun with purpose. And our goal is to empower people to choose how they live as they age.
Thank you, Nora. So I had the great pleasure of meeting with this group in advance, and we have a variety of topics we're going to try to cover today. So please be patient with us as we might jump around from topic to topic a little bit. There's a lot we want to cover. So when we think of aging, we often think of healthcare and medical care. So let's talk a little bit about healthy aging outside the healthcare system and what that means. And Mike, I'm going to ask you to start.
Sure. Thank you. Yeah, I appreciate the question because, we believe that aging is not healthcare, right? It sounds kind of obvious, but unfortunately, we view aging in this country through the myopic lens of healthcare, and we treat it as such. And so thinking beyond healthcare and the healthcare system is critical to healthy aging. So we take a look at the whole person, at the whole holistically at the environment, and we look at planning for a successful aging experience. Our desired culture here at Whitney Center for our residents, our members, and our team members is really an empowered culture. And that means that people get to express their agency, their independence in a way that moves toward their their definition of successful aging, and our role is to partner with them in doing that. And so that means we help them plan well upstream of events that we typically think of when we think about aging in healthcare, like falls and hospitalizations and these kinds of things. And that planning and upstream intervention approach makes all the difference in the world in terms of the type of services that someone might need or avoid and the cost of those services downstream. So that using that framework, we're able to help people live a much better quality of life throughout the aging lifespan.
Thank you, Mike. Lauri, do you have any comments you want to add in thinking about what aging looks like outside the healthcare and medical system?
I do. I have some thoughts about that. I think that what older people need in order to age well and also in order to age happily is to be part of a community. And I think it's something we take for granted when we're younger because we have communities in our workplace and perhaps in our children's community of school and clubs and things such as that. But for older people, there can be a terrible experience of isolation, disconnection, loneliness. To counter that isolation, it's important for people to find a way to belong to something larger than themselves. I think that community gives people an opportunity for meaning in their lives because they can volunteer and help somebody else with, let's say, something that that person is struggling with, or they can find a way to share or communicate or even teach around something that's meaningful to them, something that has made a difference in their own life. I think all too often older people, lose track of their hobbies, they lose track of their joy and, the things that really excited them when they were younger. And there's no reason for that. And at HomeHaven, one of the things we focus on is helping people to get really active and involved and interested in their own lives and in the lives of people around them. And then two other items which relate very much to what Mike said. When we think about staying healthy, it's not just our physical health. We also need to focus on brain health, cognitive health, and there's a lot written on that. There are a lot of practitioners out there who can help with that. But those things need to be age appropriate. And I'm excited about the idea of, the older community, the senior community, getting really active with dancing, yoga, qigong, hiking, walking. I've got a whole list here. Using weights, Tai Chi, all of this could be made available to older people. And finally, healthy aging is also about nutrition, and it's about sleep hygiene. It's something that I've only recently become aware of how significant that is. So I guess these are all kind of touch points for all of us to keep in mind as we age. And are we being active in all of these areas in order to have a healthy lifestyle?
Thank you, Lauri. I myself, I've been working on my own sleep hygiene, and it is amazing how much information there is out there now and what we know about how important sleep really is to our overall health. It's quite interesting. Nora, do you want to add any comments to this idea of healthy aging outside the healthcare system?
Yeah, sure. I mean, ditto to everything everyone has said. AARP has something for all of that, but I'll draw it down to Connecticut specifically, I think. Volunteerism. We run off volunteers. I look across the street and I see the state capitol, and I've got about 20 volunteers over there right now advocating on behalf of policies that we would like to put into place in the 2024 legislative session. They're in community giving presentations. They're diverse. They're making friends with each other. So when you come to volunteer at AARP, it's because you're passionate about aging and healthy aging, but maybe for a lot of different reasons. Maybe you just want to staff the events that we have out in the community. So for instance, we're talking about New Haven. We're a sponsor of the International Festival of Arts and Ideas, and we have free tickets to concerts and things like that. Same as all over the state, or you can get really specific and talk about fraud prevention and going teams of volunteers into community to help people live healthier lives, including yourself. But I also would say that I think healthy aging outside of the healthcare system is about preparation for that later part of your life, retirement security, pocketbook issues, making sure that you can maintain a lifestyle that you want to maintain, that you can age in place. And, we start thinking about that here at AARP when you're 18, and have your first, your first paycheck, and I'm probably younger, but, where you're contributing to Social Security, or you can start contributing to My CT Savings, which is a retirement program in Connecticut that is mandatory for employers to have that or something similar if they have 5 or more employees, thanks to the advocacy that we have done along with partners and along with our volunteers. But the thought process on aging well and aging healthy outside of the healthcare system starts early and starts with your family and yourself and thinking ahead. Think ahead, think ahead, think ahead. So it's hard to convince someone who's 24 that they need to be thinking ahead, but it makes a big difference when they turn 74, 84, 94.
Yeah, I'm glad you said that, Nora, because I think, when we think of the term aging, we think of older people, and the three of you have mentioned the term getting older or older people. And really, we all start aging from the time we are born. So
Every breath,
Yeah.
you're aging.
So what is, and we talked a little bit about this in our pre-discussion, and I know people think about this as they get older, like what is the cutoff, what is the age at which people are thinking of themselves as older? Or when you're talking about people who are older, who are you talking about? Nora, you said you start working with people when they're 18, and we should all be thinking about these things from an early age, not an older age. Mike, you wanted to say something?
I was just going to say amen to Nora. I just turned 54, right? And there's very little difference between the way I think about my age, where I am in this stage of life, and the people we serve and families we serve on a daily basis. It's just there's different context, but so many of the drivers, right, of our own joy and our own fulfillment and engagement are the same. So it's an extension of life. So thinking about, and more to your question, Christina, thinking about this as a lifespan issue, as a lifespan challenge, if you will, and how we marshal our resources to come together as community around one another, right, to support that lifespan as we move throughout, and as our needs change, right, and as we encounter changes in ability and so on. These are all natural, and we have to stop treating it like it's something unto itself that is almost treated as a disease, as a sickness. And I think that changing that lens is one of the keys to successful aging as community.
So how do we do that? How do we change these, I guess, attitudes about aging? I know, Nora, I think your organization has done some research about this and attitudes towards aging. And I know, Lauri, you want to say something too.
Lauri can go ahead.
Oh, thanks, Nora. I was going to make a comment about the fact that today we have people living well into their 90s. It is common for people now to live over 100. And one of the things we're faced with as a society is that this is relatively new within the last generation. Yes, there were always the outliers who lived, we all have that person in our family who lived, into their 90s, and that was the only one, and no one ever forgot that. But nowadays, it is common for people to live very long lives. And which is a wonderful thing, but there's a couple of downsides to that I think we need to be addressing as a society. One of the things is that we have no planning, as we've been saying. We have no planning for those later years. We don't have a sense of where people are going to live, how they're going to socialize, how are they going to get around, what are they going to do about transportation? What do you do when you have a large number of the society no longer driving, because maybe just driving isn't, the thing they should be doing, but they're capable of doing so much in their lives, but they can't get there? So, that's a huge issue. What about the fact that our society is so dependent on technology, and we have a whole realm of people in their, I won't even say, but 60s, even 60s, 70s, 80s, et cetera, who are always trying to catch up with technology and are feeling left behind and feeling that somehow they're not included or not connected to the key things that are happening. So I'm bringing this up because I think this is relatively new. And, you know, and I did mention that there were some unfortunate aspects. This is hard to talk about, but it is not uncommon that that cognitive impairment begins and then progresses. And we have people in many respects outliving their ability to live alone at home in a healthy, safe, independent way. And I know Mike's organization addresses this in a big way. We at HomeHaven, we try to address it, but you know, we find that at some point, people are really struggling with living alone with some of these impairments. And so I know it's not a direct answer to your question, Christina, but it's just, this is something that's like a burning issue for me that I really feel we need to look at.
Yeah, and who is looking at preparing community for this phenomenon, not just preparing organizations or individuals, but making sure our communities are prepared for this. Nora, you have additional comment?
You know, I think, so I'm not a direct service provider, right? Like the two panelists are. So I come at this from a slightly different perspective, right? I'm a state office of a national organization. And, you know, what everybody has said is correct. And, you know, the reality of aging is radically different than it was a generation ago. And for that reason, there are a lot of outdated beliefs about aging, right? So when you talk about the changing attitudes about aging, we got to look at solutions that are shaped by these outdated beliefs and figure out ways to sync up the reality of today with what people are experiencing and combat those outdated beliefs. So we have something called disrupt aging, and it kind of goes after both barriers, outdated beliefs and the lack of new solutions. So when we look at it like nobody's possibilities should ever be limited by their age, we can start to be sort of innovative and think about what can come into the marketplace, what kind of solutions happen at a policy level, what kind of attitude changing programs do we need to create so that everyone starts thinking that no one's possibilities should ever be limited by their age. And, you know, you're motivated by something different when you're over age 50 than you were when you were 20 or 30. You're at a different place in your life. You see the world through a different lens. You know, you're shaped by more ups and downs and the wisdom that you've gained. And so, you know, we're living decades longer than great grandparents probably. And so how do we spend those years? And I think there's a lot that goes into that when we talk about, I think if you want to move attitudes overall, you need to look at economic impact and the longevity economy. And I'm happy to talk more about that. But taking it from a broader perspective, our country values value, and older Americans have value for companies, for communities, for tax bases, for employers. And I like to look at it from that sort of bigger picture.
Go ahead, Mike.
May I add something to that? So, yeah, I think both, you know, Nora and Lauri bring up great points. And what strikes me is it kind of goes back to the healthcare system myopic lens, right, that we've used. We're very sort of fragmented, not sort of, we are very fragmented in our approach to things. And because from a healthcare view, right, we look at symptoms and we treat symptoms and we treat illnesses, right? And so you asked the question, Christina, who's looking at all of this, right? And the answer needs to be community. The answer needs to be an integrated approach, systems thinking, innovation around solution sets, not a solve for how do we provide more support in dementia services at home, right? That's part of it, but all of these things are inextricably tied together in community. And unless we start looking at these issues through that broad lens, we're not going to be able to resolve them. And it's exactly what Nora's saying. It's economic in nature, it's value orientation, it's design and planning in towns and municipalities. It's all of these things. You know, the World Health Organization has, has criteria for age-friendly communities and dementia-friendly communities and, all of these things. But unless we come together as a whole community and look at systems integration, we're not going to be able to address this. And it requires us to get away from that symptom sort of episodic approach to responding and trying to fix individual issues.
That's a big undertaking, Mike. Are you volunteering to take the lead on that integration project?
Hey, listen, I'm in. If we can get some partners together and as a community begin to have conversations, including folks, who are stricken by dementia, including folks that are like, centenarians and their families. I mean, all of us together, right? And including our middle schoolers and high schoolers, right? And how do we come together? I'm in.
Great. So we have a couple of questions coming in, and before I get to the questions, I wanted to shift gears a little bit, and then we'll ask some questions. Nora, you mentioned the value to employers and the economy and the tax base, and I learned from you that there are significant changing demographics in the workforce. Well, I experienced that myself, but what I learned from you is that for the first time in history, we have 5 generations working together in the workforce. And I'd love for you and others to say more about that. What are the implications and experiences? What are the challenges and the opportunities of this phenomenon that we're all uniquely living in right now?
Yeah, so I think it's exciting. We've got everybody from the silent generation to Gen Z working in the same place in some cases. And, about 10,000 baby boomers will reach retirement age each day between, I think, about 2011 and 2029, but only a little more than half of those folks are retiring. So, we've got over a quarter of the workforce in America is age 55 and older, and that's way up since 20 years ago when it was about 14 or 15%. And the largest group of growing, the largest segment of growth in the workforce over the next 10 years is age 75 and older, followed only by those 65 to 74. So it's a big deal, and we need to address it. And I saw one of the questions about being encouraged to retire, and we can talk about that. But I think one of the things I want to warn about is we talked about generations, but don't use it as a catch-all for blame or for reward. The entirety of a person's life is their life experience and what they bring to the workforce. And a Gen Z and a baby boomer have significantly different life experiences, but this is opportunity, especially from a business perspective. Because, when I talk about disrupt aging, or I talk about workforce, or I talk about bringing people back out of retirement into the classroom to teach in things like manufacturing, I always say, what's less innovative than a workplace full of people of the exact same perspective, right? Older workers bring wisdom and experience to the table that a younger generation might not have. Also, the younger generation brings in maybe, experiences and a way of growing up that's much different than the way that the rest of us did. And mentoring is a two-way street. So I would challenge, and then I'm going to be quiet because I could go on about this for the entire time. But any of you out there who are running an organization, working in HR, et cetera, how many of your companies are including age in your diversity, equity, and inclusion policies? So think about that, because if you're not, you've left out an entire category of diversity, equity, and inclusion. And my challenge to you is to go back to the drawing board and make sure that's in there.
Thank you, Nora. Mike, do you want to add to this conversation around aging and changing demographics in the workforce, the workplace?
I agree wholeheartedly with Nora. I think we have to expand our thinking on the supply side, right, of workforce, because we just don't have the same interest, and COVID just accelerated it. I think we were going in this direction, certainly in the healthcare professions, but but we're seeing in the hospitality professions and other kind of facilities maintenance and other business jobs. So looking at different generations and more important than age, I think, is the diversity of thought and perspective and thinking style, right? Those experiences influence the way we think, the way we process information, how we can see possibilities. And so the more experienced folks, regardless of age, right, will bring that kind of thinking, while folks with newer experiences are going to bring a different kind of thinking. And whenever we can mash up those different thought perspectives and thinking styles in a room, I think we get much better outcomes, much more creative problem solving than we can otherwise. And you know, we've lived that 5-generation workforce. You know, not too long ago, we had folks working for us that were as young as 16, as old as 84, right? And you know, and that fluctuates a little bit, but we're right there, 4 to 5 generations on any given day that we've got working here. And so we have to accommodate and find sort of the narrative and the community support around all of those perspectives.
So I'm going to get to a couple of the questions we have that have been posed. The first one is, why aren't you acknowledging that each decade of aging presents different challenges? It's kind of like 4 years of college. Each presents different aspects of growing up and widening social perspective.
Well, I kind of think we did acknowledge that, you know, and I think we all are fundamentally on the same page with that. Listen, I'm about to go to graduation for my stepson from college. There's a very different perspective than when I go over to my parents' house and my dad just had neck surgery and, you know, has a life experience where he wants to go do come the end of May that what my stepson wants to come do at the end of May. I mean, I think the experiential part of this is key for all of the things that we're talking about here. So, I mean, I'll be quiet and let someone else answer, but I don't think we're failing to acknowledge that. I think it's a huge part of the workforce, the longevity economy, the social integration, and everything else.
Lauri, you wanted to say something?
Yeah, you know, HomeHaven has 250 members, and I would say that those 250 people are each having their own unique experience of aging. This is a one size does not fit all. You know, everyone goes through it differently. You can have cognitive issues in your 60s, and you can have no cognitive issues whatsoever in your 90s. You know, we have a member who is getting ready for a trip to Europe. She's 96, going off to Europe. You know, you don't do that with cognitive impairment. It's not possible. So it's very personal. It's a personal experience, and how you respond to it and how you resolve the issues that arise are, again, very personal. But there are things we can do as a society, as a community, to support that process. And, you know, in response to the question about stages, okay, I would say, if I have to, 65 to 75 is a kind of a span. 76 to, let's say, 85 is a little different. It's a little different. And then from 86 over, and again, there are the outliers who are just going strong, you know, into their 90s, and there are people who are struggling, you know, much younger. So I understand the questioner's interest in, you know, trying to do this, but you can't plan it. What you need to do, though, is be aware of what the possibilities are, what you might run into, and then do all of these healthy aging things that we mentioned earlier about, you know, getting yourself into an exercise program, making sure you're socializing, making sure your doctors are aware of your issues, connecting with people of different generations so you're getting stimulated, continuing with your hobbies and your interests. There's no reason to drop any of that. And I could go on and on with that. But, you know, again, I'm speaking very much from the village model, which is what my organization is part of. And, you know, maybe later I'll have a chance to say a few more words about that.
Mike?
Yeah, if I could just add, or maybe highlight a couple of things. I appreciate where the question's coming from, because it does, to me, it triggers a couple of things. One is this, and Nora, you alluded to it, is this monolithic view of age and age cohort, right? Clearly, even at 5-year cohorts, right, folks are not the same. We can't approach any group of people as a monolithic group, right, that have the same characteristics and so on. And that's, there's some common sense in that, right? But yet we still tend to classify and categorize because our Western thinking logical brains need that in order for us to process things and make sense of things. And so this is a difficulty we have, and it leads to the second issue, which is this lens of ageism because of that. And so, Lauri, I agree with you fully that while traveling to Europe in, I think, 96, right, without cognitive brain change makes it easier, it can be done even with cognitive brain change. That the key is what supports and services are in place for me to access, right, at any age, right, so that I can do the things I find are fulfilling and that I find, help me engage in life. That's the key. Regardless of age, what is the set of supports that I have access to and knowledge of and awareness of, right, that I can tap into? And I think that's what when I talk about community coming together, that's what I'm talking about.
Can I follow up on that a little bit too? Because Mike, I mean, I think I did an interview, I don't know, a couple weeks ago after there was a wrong way crash on the Connecticut highway, and it was a gentleman, I think probably in his 70s, although I'm not 100% sure. There's been a lot of talk about wrong way crashes in Connecticut, right? Very rarely is the dynamic around that age. The dynamic around that is almost always substance abuse or substance use, right? In that case. And so when I was having this conversation with him, I am kind of refusing to fall into that trap that once you hit a certain age, 62, 65, whatever it is, 70, that you automatically have problems driving. Because there are many people with health issues who are in their 20s, 30s, who may have an issue that prevents them from driving well. And I don't want to, of course, there are issues that naturally come more likely with age. There are certain places where heart disease usually becomes more of a problem, cancers, cognitive issues. But there's a reason the aging and disability community works together, is because there are so many things that we're set up for as a community, as a state, as a nation, that don't address well for any of the folks who need it, right? So Mike, to your point of for any age, we need to be talking about how we support people. Lauri, when you brought up transportation earlier, I mean, transportation is a problem for lots of people, whether it's because you can't drive because of a medical reason or a cognitive reason or vision, maybe you just can't drive at night, or because you can't afford to own a vehicle in this state, or you have a disability. So I get the point. I also am kind of at a point in my career after doing this for 12 years at AARP and working in disabilities before that, that I kind of don't want to fall into the trap when it comes to, because I think it perpetuates the problem of people who are older, define it as you want, being sort of discriminated against as a result of being older.
Right. So there's this other comment in the Q&A that I think it'd be great to get your reaction to. And this person is saying that there's no question this is a significant issue. This person is saying they were just encouraged to retire and did. And it was amazing. And they seemed surprised by how much they didn't know about accessing their benefits. They consider themselves a well-educated person, and they didn't know much about how to access Medicare or their 403B or Social Security. And you all have talked a lot about the things we can do, whether it's join an exercise class or get involved in community. And this person is talking about, accessing some basic benefits. What are some of the concrete how-tos? How do people take those steps, whether it's accessing benefits or picking up a new hobby or becoming more engaged in community or any of the things that you've talked about?
I'll start because I know, Nora, you've got a bunch of resources on this, and Lauri, I know your organization is helping one another, right? Your volunteers are helping one another with these kinds of things. So I'll just offer this maybe to kick it off, and that is the fragmentation of services is the culprit in the fragmentation of how information becomes available and is accessed by individuals. I happen to be, we belong to a national organization, association called Leading Age. There's a chapter here in Connecticut and there's a national association. And we were on Capitol Hill yesterday in DC, meeting with legislators and their aides. And one of the aides, it was to, I think it was Senator Murphy's aide, actually said, she is highly educated when it comes to healthcare and long-term care and all of these things, right? And she has two parents that are PhDs. And they almost had to go back to school and get a doctorate in insurance language and understanding, deduct all of the things that you have to understand, just in that little piece of this question. And if they're having that kind of trouble, imagine the trouble other people are having. And so there's so much noise in the system, and the system is broken and fragmented. So it's very, very difficult to navigate. And it's that word that I want to key in on and maybe flip it over to my co-panelists, right? It's help in navigation. Our Thrive at Home program that we have is about not only coordination, but navigation. And that has become a key element, is helping people become more aware of what's available to them that's relevant to them. Otherwise, it's like drinking, water from a fire hose, right? It's not all relevant. It can't all be absorbed. So understanding in a meaningful way what's important to me, what is the information I'm looking for, and being able to navigate all of that, we've got to come up with better methods of accessing all of that information.
Right.
Go ahead, Lauri.
And if you're not comfortable on a computer, forget about that. Forget about that, because that's where the information is. Try to get the information with a telephone call and you will be put on hold somewhere forever. I mean, it is just impossible. So, what are the solutions? There are various care navigation programs. As Mike said, Whitney Center's Thrive at Home program has a wonderful care navigation aspect of their program, a way that they help their members who are living at home, still living at home, navigate the system. Jewish Family Service has a care navigator program. And then there are some private people known as geriatric care managers. And this is kind of a subset of social work. Unfortunately, it is not, I think it is not being well enough promoted in the social work schools. I mean, we need a big team of geriatric care managers to get out there and be available. And I'll just throw out a thought. What if churches, temples were able to publicize to their members? I'm trying to think of where are the seniors that are not engaged? Who are they connected to? Who do they know? What are they doing? So let's say churches and temples. Let's say senior centers. Maybe there could be a way that care management was somehow brought into those settings and made available without people having to find it themselves. Because those people, those professionals that I'm mentioning, they do know how to navigate the system. And they do know how to take that hose and that stream of information and parse it out into manageable pieces. This is what social work is about. But we're not using it well enough.
Right.
And at HomeHaven, I refer our membership, I refer people to care managers often. And in fact, in May, we're having a special program just on this issue because it's so important.
Christina, we're kind of, in response to this question, AARP is kind of like the Google of this, and that can make it really hard even on our site to find stuff, right? So I think I wanted to just draw people's attention to two things. One is Aging CT, which is the new home for all of the area agencies on aging. They've rebranded themselves, so no matter where you live in the state, you fall into a catchment area for an area agency on aging, which has state, federal, all sorts of stuff going on, and they know a lot. Now, granted, you know, there can always be a wait. People are who they are, and there's, you know, employees not there and whatever, but Aging CT is a great place to go for, they're really trying to figure out the no wrong door for all sorts of stuff, including the everybody question and concern about how the heck do I figure out what I'm supposed to do for Medicare? You know, I mean, your federal tax dollars pay for something called the Choices Program in Connecticut. There is money flowing down that if you have, I encourage people to go every year and talk to a Choices counselor about what they should be doing for their Medicare, because you change, so do the policies. So, you know, go and talk to the folks you've already paid for. They're embedded in senior centers and the Choices counselors. I'm trying to find my one phone number and I'll type it in, 1-800-994-9422. They can get you where you need to be. And then additionally, I put in our events page, and this is kind of a small answer to a very big question, but like next week we have a 101 webinar on, so I need to access my Social Security benefits for the first time. What do I need to know? It's super 101, but we also have one for Medicare coming up in a couple weeks. So all of our events are free. You want to go to a movie, a baseball game, a webinar about cooking, or something about Social Security and Medicare, it's there. Anybody can join us. You do not have to be an AARP member. I don't care if you're 12 or 112. So I'm going to type that phone number for the Choices counselors about Medicare and healthcare decision-making into the chat.
Thank you, Nora. And we could provide that information in the follow-up email too. We haven't really talked much about the impact of the pandemic. And I was just thinking, you know, during the pandemic, we all became quite isolated, especially older people who may have already even been somewhat isolated. And I'm sure there were many implications to that. Is that getting better? Are people coming back out now? I know many, especially older people, were afraid to come out. Are we seeing those implications kind of reversed in any way, or is that still a challenge?
I would say because we provide housing, right? So that's a big part of our offering. We saw that people isolated throughout COVID, and while that has shifted, it has not gone back, because there are folks that are still just absolutely petrified. You know, it's still out there, and it's a real fear that is alive in their minds. And so I think the thing that we've learned or are learning that COVID helped, one of the things that COVID actually helped with was the recognition of loneliness, isolation, right? That's a I don't know if pandemic's the right word, but that's a huge issue unto itself. We have a lot of solo agers, right, in our country. We have a lot of folks that are they're affected by shame, embarrassment, and other elements of cognitive brain change, of physical things, you know, when their identity is wrapped up in what they used to do, their profession, or, you know, their abilities, and they start to lose those functions, that becomes an issue, and they withdraw and isolate. This is a huge mental health issue in our country, and we have to pay much more attention to it, and it has to be part of this holistic view of healthy aging. We have to take this into account. So I think that the highlighting of this issue through COVID was a good thing. Now we've got to be able to, and this goes into the morass of psychiatric services, mental health services in general in our country, which is atrocious,
right,
as a system, right? But we can start to make a difference if we include this in the discussion.
Thanks, Mike. There are some other questions here from audience members that I want to try to get to. This is kind of a policy question. Maybe Nora, you could answer this one. Is there any hope to change in Social Security policies to reflect the current demographics, extending the age of contribution, requiring contributions from higher incomes?
Well, yes, and not quickly. We are in a 10-year campaign, and I'll explain why it's 10 years right now, at AARP nationwide. As part of every candidate running for federal office will be asked these questions by AARP in every state. You can find lots on AARP.org under our politics session. Every Republican presidential candidate was asked in the run up to the final primaries. But we have a issue with Social Security that if there's not a fix in 10 years, everybody's monthly payment is going to go down 20 to 25%, whether you're a current enrollee or brand new onto the program. So there are a lot of issues that make up solutions to that. We're not necessarily saying at AARP it's this solution or that solution. What we're saying is, where are you on this? Because if everybody's paycheck goes down 20 to 25% in 10 years, what are we going to do about it? Certainly efforts on our part about, the bringing Social Security. There was a big effort just recently, and it is ongoing. And the closer we get to the elections, the more I expect to hear, but about making Social Security part of the debt conversation. That's our money. That's your money. You earned that. That is not part of the national debt. So yes, and it's complicated is my answer. If anybody wants to join me in becoming a volunteer to work on that issue, my email's in the chat. But that's a major focus for us for the next 10 years and in every election, because I think we all know Congress has a tendency not to act until the crisis is upon us. But the crisis is coming. Mm-hmm. And if you think it's crisis now, just wait 10 years.
Thank you, Nora. Mike, did you want to add to that?
Yeah, this is kind of a tangential thing, and so I won't spend too long on it. But so Social Security, the concept, right, is planning for the future, right? It's in that realm of thinking, and it's not just about the dollars; it's about effective use of those dollars. And I think one of the things that I wanted to say earlier, then this triggered it, is that if we were to create within our EAP programs, our employee assistance programs in the realm of the workplace, future planning around this issue, not in particular Social Security, but rather aging and planning and resources, right, as an employee benefit, I think we can start to stem the tide and the whether Social Security, that's way too complicated a question for me to even start to try to answer. Nora, thank you. But I feel like the same kind of thinking about future planning can happen in the workplace as another means to address these issues. That was sorry for the tangent, but I wanted to get it out there.
No, that's okay. Lauri?
I promised myself I wouldn't get political, so I won't. But I just want to drop into the mix that we have a real problem with our priorities in our society. And I firmly believe our priority should be the needs of people, all people. And fortunately, we've been able to bring attention to the needs of children, the needs of disabled. The Community Foundation has been so instrumental in serving the needs of underserved populations in Greater New Haven. I mean, you all have done a great job with this, Christina, your entire organization. But the society as a whole is really not paying that much attention. And what I mean is the policymakers. I'm really not talking about society. Our policymakers are not focused, I believe, not focused properly.
Yeah, Lauri, I agree with you, but think about who the influencers are. When we look at, for example, when we look at marketing and media and who the target audiences are, right? I mean, we're seeing more and more, you know, more and more advertising that's not, you know, the I've fallen and can't get up commercial, right? We're seeing more things oriented towards the older demographic because it is that longevity economy that Nora's referred to a couple of times. Folks are catching on, right? But the influencers on policymakers tend to be the mainstream narrative, which is ageist in its view, and so that's one of the things we have to start to address. Is it because, let's face it, policymakers, you know, elected officials are going to go where votes are, and they're going to try to address, you know, these issues for a broad base of constituents, but they're going to go with the folks that really vote, and that's why we actually emphasize that. And here I have to say at Whitney Center, the residents that live here are really active in that sense because, you know, policymakers, elected officials know that they vote. Right. And they're a force. And so that's how we can really, you know, just at a grassroots level, right? Activating that power, I think can, you know, start to push the needle a little bit better.
Thank you. Thanks for that. There's another comment here as we start to wind down. One aspect not yet touched on is the issue of legacy, charitable or philanthropic giving. Trillions of dollars will be turned over from older to younger generations, which is relevant to some segment of the older age group, but also important for nonprofits and others involved in fundraising to think about. And of course, this question is right in our wheelhouse, as the community foundation is built on the legacy of hundreds of donors and 3 generations of donors. So let's hear your comments on legacy. Who wants to start?
Well, this is going to be from a very sort of narrow lens, and so I don't have a lot of experience in this area, but I'll just say this. I think that there are some wonderfully creative and innovative ideas that are out there in various, you know, various corners of our communities, and the ability to access funds to support those studies and those ideas and helping them come to fruition, I think is something that we're looking to do more and more of, right? Is to look at how part of that legacy can be to perpetuate a greater good sort of outcome, right, for our communities in general. And so I think we do need to tap into that, and hopefully rather than see just a simple transfer of wealth, that we can see a broader distribution of investment in community to help leverage those dollars in ways that can have profound impact across, you know, many lives.
Lauri or Nora, do you want to comment?
Well, I'll say this. I agree that it's an important topic. I agree with what Mike said, and I'm pleased that the community foundation and community foundations like it statewide and across America care about these issues and take charitable dollars and legacy dollars and invest them wisely. I spent the other half of my career representing about 500 nonprofits in what is now the Connecticut Nonprofit Alliance, but wasn't then. And so I know I also had to do a lot of fundraising, and I blessedly do not have to anymore. One of my favorite things about AARP. Somebody else does that. But you know, society doesn't function well without the non-governmental and nonprofit organizations that focus on the key needs of society. You know, and everybody can't be everything to everyone. So my feeling is, you know, keep giving, direct your giving to the things that you think is the most important, and be charitable, because that's, people show up when government can't or won't, and people are really what makes it matter.
Thanks, Nora. So as we wind down this briefing, which has been really great, I'm going to ask each of you if there's any last comment you want to share, or advice, or is there something out of this whole conversation, some kind of priority issue that you really want to make sure the audience is paying attention to or thinking about that we haven't talked about already? Lauri, go ahead.
I guess what I appreciate the most about this conversation is that it gives us a chance to articulate the issues and perhaps speak for a segment of the population that generally does not have its own voice. Not that they're not capable. And again, I don't want to sound ageist, but I'm just saying often for older people, for older adults, there may not be a forum. There may not be a place where they are expressing what they need. And so I appreciate so much that we have an opportunity to do that. HomeHaven is part of a national village model, and there are more than 300 organizations like HomeHaven around the country. I say like HomeHaven, yet they're all different, and it depends on the demographics of the community where they function. It depends on if they're urban, suburban, rural, or some mixture, which is actually HomeHaven is a mixture of all of those, really urban, suburban. What I wonder about is whether what we've learned in the village movement, which is that we want people to care for each other, care about each other, and connect to each other the way people did when they lived in small villages back in the day. And I don't know how far back we have to go to find that, but there was a time, and there was a time in this country for sure when that was true. Is there something that we can take from the village model and bring it out into the larger society? I'm very interested in doing that. I'm very interested in taking what we've learned and seeing if it can be replicated in some other way throughout the community. HomeHaven is again, relatively small, 250 people. That is small for Greater New Haven. It's a private nonprofit, not private, but it's a private organization. So it's not a public entity. So that's my final thought.
Thank you, Lauri. Mike?
Yeah, so thanks, Lauri. I think so 3 quick things. One, I do think that there's opportunity for different models to come together, right? And going back to that integrated systems thinking and innovation, right? What's working well in these discrete models, and how do we bring them together and integrate them to create a better support network in terms of helping to build community. So I agree with you there. I think I saw a comment by one of our residents actually asking about end-of-life planning. And I think this is another element that we don't talk about a whole lot, but needs to be more prominent in the conversation, because it presents a healthier view of aging, and where we could sort of deal with these things and free ourselves to live more engaged, fulfilling lives, because we don't have these kinds of things hanging over our head. And so more resources on end-of-life planning. We actually created one of our teams, our Thrive at Home team, created an actual planning book, which we're looking to scale, which is all about what happens if, right? And where are all my passwords, and where are all the documents, and all these things. But these resources, right, that they're hard to come by, and so we need to get together on those issues. And the last thing I'll say, the big takeaway that I would just like to just reinforce is zoom out and look holistically across the spectrum of community, and at all age ranges across the lifespan. And that, I think, that is the way forward. And so I would just endorse, getting out of our silos, growing our lenses, which can be very myopic. So I know we're running out of time. Nora.
I'll just say quickly, everyone said a lot of really great things. And I would say, I'm seeing a lot about talking, knowing each other. I'd say raise your voice. Raise your voice. That's what we do at AARP. We empower people to raise their voice to their policymakers. It's not political, it's policy. Okay, so it's nonpartisan policy action. You take it on it, whatever you think is important to you, climate change, whether you think it's AARP issues, whether it's animal welfare. I encourage people to take what they're passionate about, volunteer for the organizations that they're passionate about, and raise their voice in their community and with their policymakers. And you want to do that with me? Give me an email.
Thank you. Nora, and to, this idea of community and coming together. We can see in the chat that a lot of people are, thinking about how to create a community just among the group of attendees here and interest in doing that. Thank you all so much, Lauri, Mike, and Nora. This was really a great conversation. And thank you to the audience for being here with us. I will remind you all, you will get a pop-up evaluation at the end of the webinar. Please fill it out because it does inform our topics and future webinars. That is what got us this topic today and these panelists today. And again, don't forget the Great Give and our annual meeting. Save the date on June 17th. And I hope to see you all soon. Thanks and have a great afternoon.
Thank
Thank
you.
you so much. Thanks, Christina.